Erika Haviland, and this is Jessica Cushing-Murray. We're third-year students. So, as you all know, hypertension and noncompliance is not a novel idea to hospital medicine, but we wanted to highlight this case as we felt it was an interesting sequelae of events in a patient with uncontrolled hypertension. So, hypertension is one of the most predominant complaints in hospital medicine, but we thought it was interesting that fewer than 50% of patients achieve their target blood pressure control. In most cases, this is secondary to compliance issues, which requires both physician education of patient as well as patient willingness to take daily medications. So our case, we present a 63-year-old male, Caucasian male with only known medical history of high blood pressure and was non-compliant. So he presented after having a fall and being found, he was found incontinent. On ER arrival, his blood pressure was 195 over 145. And this was after he was found down for an unknown amount of time. However, that same day he left AMA from the hospital. He was brought back the next day after his family urged him to come to the hospital and get worked up. He was still similarly confused and just found to be unable to care for himself. Family confirmed again what we already knew, is that he did not take any medications at home. On his initial workup, his CBC showed an H&H of 5.8 and 16.9 with a positive hemoccult. CT and MRI were done, and MRI showed cerebral atrophy with just prior chronic brainstem infarcts. During his hospitalization, he required multiple investigations. First, on day 4 of his hospitalization, he did become unresponsive and was found in PEA. He required 15 minutes of CPR before successful return of spontaneous circulation, as well as he was intubated and transferred to the ICU. Subsequently, he had an EKG that showed ST elevation, and he was taken to the cath lab with multiple unsuccessful PCI attempts and no reflow distally. His original presentation with recurrent falls and low H&H on admission suggested an upper GI bleed, so EGD was performed at that time, revealing multiple ulcers in his stomach and duodenum, and one required clipping to prevent continued bleeding.
Yeah, so on his diagnosis and management, obviously he required a lot of different things during his hospitalization. He was ultimately diagnosed with hypertensive encephalopathy due to his medication noncompliance. But it was also complicated by this GI bleed secondary to both gastric and duodenal ulcers. And we just want to talk about how multiple diagnoses like this, acute toxic metabolic encephalopathy, vascular dementia, hypoxemic brain injury, all of these things that are pretty common to hypertension that's uncontrolled. So he received multiple red blood cell transfusions when he got to the hospital and required further transfusions during his hospitalization for this GI bleed before it was finally able to be stopped during the EGD. He also required volume repletion, and obviously hypertensive medications because his blood pressure was consistently in the 200 systolic. And he required antibiotics eventually. When he was intubated, he developed aspiration pneumonia and sepsis and a pleural effusion. His GI bleed did require banding and clipping during the endoscopy. So on outcome and discussion, like she said, when we introduced the case, hypertension and noncompliance with medication are not novel ideas, but this patient not having an H. pylori diagnosis or known NSAID use, according to both family and his fiance, suggests that his uncontrolled hypertension led to his gastroduodenal ischemia and these bleeding ulcers, which is a relatively uncommon consequence of hypertension. So this patient case, we just wanted to highlight that when someone is non-compliant with their medication and hypertension, considering all the organ systems and not just, the brain and the heart and things like that. And then we also wanted to highlight non-compliance in general. And while this can be due to multiple factors, the chart is kind of hard to see, but it was just asking patients why they were non-compliant with medications, whether it was they didn't have an interest in taking them, they didn't know why they helped, or they couldn't afford them. So just highlighting the need to continue patient education with their medication so that non-compliance can hopefully become less of an issue in the future. Thank you.
Any questions? How did you guys balance volume repletion with the consistently high blood pressure and also the heart problems after his STEMI?
Yeah, it was a long ongoing process. There were a lot of issues with his case. I mean, he couldn't go to the cath lab for a while because he was having all these other issues, and then he developed the pneumonia and the pleural effusion, but he was still requiring fluids. It was just like a tremendous balancing act. And when he came in initially and he had the really low H&H, they wanted to do the endoscopy right away. He was altered, and his surrogate healthcare person lived out of town, so he didn't even get the endoscopy for like a week into his hospital stay. So it was a very complicated course throughout his hospitalization.
Thank you.